a very limited meeting for tonight. But what is really would be the main agenda is the discussion of the continuing increase of COVID patients in our land. So education, yes, ma'am. Take your time, ma'am. You have to
Yeah.
tell.
During our last meeting last Monday, you asked us to present a formal proposal on the advantages and disadvantages of having limited face-to-face learning at this time, pero limited only in areas where there is low risk assessment and where there is compliance with the requirements of the Department of Education, as well as compliance with the minimum health requirements of the department.
Yes.
Only in
I
these
now
places,
remember
not
it.
for everybody, only for those which are considered low risk. And if there is face-to-face, it will not be for the entire 5 days of the school week. It could only be 1 day or 2 days, and the sessions could be limited to the most important things that a child should learn. And it is now being done. LaSalle did it. They started last June, and there's a very small school in Siquijor. It's also started last June, also with limited face-to-face, and it's working. So the local government officials have been writing us, and international schools also have been writing us and requesting if we can allow limited face-to-face for those who will be able to take the necessary precautions. And so we have submitted, Mr. President, to the Secretariat both a PowerPoint presentation as well as a text describing how it's going to be done.
Yeah.
Yeah. So we are complying with your instructions. And if I may divert, because a while back you were talking about medicine, we have Filipinos who finished medicine in Russia, and they are practicing in the Philippines. My niece finished her studies in medicine in Russia for 7 years in the Russian language at the top of her class. And she's now provincial health officer in Catanduanes, and there are several more. There was a period when Filipinos went to Russia, but without the usual official arrangements, and they finished, and some of them are back, so they can really vouch for the high quality of medical education. But to go back to face-to-face, I am just submitting. You may not have time anymore at this hour to listen to the presentation.
No, I have.
Okay. Yes. Can I please?
I
Yes.
must listen to you, not only find the time.
We are very pleased and happy to report that in terms of the public and private school enrollment total, in spite of the combined impact of COVID as well as the destruction on the economy, the downturn of the economy, we were able to achieve 77% of the total enrollment compared to last year. Sa public, 90% of our students last year ang naabot natin. So, in spite of these two very difficult situations na kaya natin, ang ating problem is with the private school enrollees kasi only 27% have returned. And we now have this, what I describe as the phenomenon of private school students migrating to the public school. Ang latest number is 347,860. And this is because, Mr. President, the private schools have been affected by the downturn in the economy. The parents who lose their jobs cannot already fund the studies of their students. So I also have presented a timeline when we all started. We started our work April, May 28. That's when you express support for blended learning. And when you gave instructions that you will not allow face-to-face learning, we also correspondingly took out from our learning continuity program the face-to-face learning portion. But right now, Mr. President, we are receiving many queries and many requests from local chief executives, from legislators, private and international schools. There are 71 international schools all over the country, and they are requesting if limited face-to-face classes can be held. I have here a few slides which I will not repeat anymore, wherein we showed that children are not as badly affected by the COVID phenomenon as the adults, especially the elderly. We are saying that of the total confirmed cases, for example, out of our 67,456 confirmed cases, only 2,832, most of them also mild, or 4%, 4.20% are children. And in terms of our records, Mr. President, we only have 16 recorded deaths of children, which is 0.87% of the total deaths as of July 19, Mr. President. No. So now I go to the possible terms and conditions. What would be the advantage of limited face-to-face? Well, both the learners, our students, and our teachers are familiar with face-to-face learning, so they will not have difficulty adjusting. Administrative costs will also be lower, and also the limited face-to-face classes closes inequality gaps, kasi kung we rely, for example, heavily on online learning, then you will have equity problems for those who may not have access to digital equipment. And also, this is the most important, when we teach our children, we teach them not only about facts, about knowledge, about philosophies, about history, but we teach them how to deal with their fellow human beings. And that can only be attained to a great degree by face-to-face interaction among children, especially as they are young. Now, some of the disadvantages are, of course, the health risks. That's why we want to limit very strictly the implementation of face-to-face, and also the administrative costs, because maintaining the health standards and so on, and also of our own buildings will also be costly for us. Now, what are the possible terms and conditions which we can impose, aside from the fact that those who will be allowed to do so should be at the lower risk assessment? So we say that the first condition is that it can only be allowed in low-risk areas, or those at least under modified general community quarantine in the transition phase. But it has to be on a case-to-case basis, as advised by Secretary Galvez. The next is, we were thinking that up to January 2021, during the third quarter, we can start allowing. Between August and at present, we will be assessing the schools. Secretary Galvez advises us to make physical inspections of the facilities of the schools. So we can do it up to January, but as I said, LaSalle already is into it since June, and then the little island of Siquijor has been quietly having its own version also since June as well. Now, what are other terms? We are saying, for example, Mr. President, that we should be coordinating not only within DepEd but the LGUs concerned, because they are the ones asking for it mainly, and the local health authorities. And then the fourth condition that we would like to impose is we have to have stringent health standards, especially at this time. We were thinking perhaps August, no, but with the new developments, the numbers, and so on, we should be imposing stringent health standards as suggested by the Department of Health and also by AITF. And some of these will take time, like preparing the buildings, making sure that social distancing will be observed, and also how do we do physical education. And there's also advice that we have to, but this will not be difficult for our public schools kasi hindi naman sila air-conditioned, dinidiscourage ang air-conditioned classes, etc. And also, number 5 takes into consideration very seriously the advice of Secretary Galvez and Secretary Anyo that we have to have a joint inspection. It's not automatic. Kung low risk ka, pwede ka nang mag-open. No, they have to be inspected. And I was saying that DepEd, since the time of your mother, is structured in such a manner that you have people down to the principal level, the superintendent, and so on, who really know what is the situation at the frontline level. So we want to follow the advice of the National Task Force. So in summary, Mr. President, for basic education, we are saying that maybe we can allow limited face-to-face learning, but to be strictly regulated in the light of present conditions. So we have to listen to at least 4 agencies which would have an interest in the matter. One, the location of the schools have to be assessed as low risk, but that is only the first step, Mr. President. Secondly, our schools have to be friendly to the idea of face-to-face during the time of COVID. Like, we cannot allow schools with very small classrooms. Kung small ang classrooms, we have to adjust the number of students in a class, maybe 10 per batch and so on. And then they have to be in good state of repair. They are safe kasi dumaanan ng mga bagyo, may lindol, may putok ng bulkan, and we have to make sure na even if they are safe from COVID, they might not be safe also from weak or weakened buildings of ours. So, kailangan din standard and physical condition ng aming schools. And then, importante is that the schools should also meet the minimum health standards. We have already, as per your instruction, we already have organized and created also our minimum health standards, and it is in writing. We have circulated it actually in DepEd already, because school or no school, we are imposing the minimum health standards. And this is in consultation with DOH. We benefit so much from their advice. And then fourth, the host local government, because they are largely the ones who are asking for this, aside from the international schools, they have to be ready to support financially the schools, because they have the SEF. SEF is a national tax on real property, 1% of which should go to education, and which the provinces collect. So it's a national tax. It's our national tax, which the provinces are collecting, yung SEF, the Special Education Fund. So they have to be prepared to help finance the needs of these schools. So itong 4 na conditions, Mr. President, have to be fulfilled before we allow limited. The accent is on limited, because the public is reaction na may meme pa sa Secretary of Education na I said daw patay kung patay, pero kailangan magklase, which of course is not. I would not be capable of making such a statement. It is widely circulated, and so this is very important to us to continue the learning process. but at the same time, assure the safety of our students. So, ayun, Mr. President. And then we have a written text also about this presentation. So, ayun. For your consideration. Limited lang talaga, sir. Like, those who are asking are like Siquijor or like the Nagat Islands, Siargao. They're the ones who probably halos zero level, and then local governments who are now declared as low risk. Yun, sila ang
I'm with you on this.
Thank you.
Let's try to make ourselves productive even how constricted the times are. Okay ako sa ano.
Thank you. Thank you, Mr. President.
Any other report that yung General West, you want to say something? Ang ano nito is it's very hard for us really to impose itong ano yung paglabas ng tao, and even in the wearing of the mask. I hate to, personally, I hate to arrest people for the mere violation of a rule which is says that they have to. Ang problema, kailangan masyado ang cooperation ng the mayors have to do more. They have to do more. They have to take care. I think, I'm addressing myself to Secretary Anyo, I think that if there are so many violations in a particular place, and, well, of course, the police is lacking in the enforcement of inadequate response to the rules that we are imposing simply because we want people protected. So, pwede naman sa yung ipatawag sila. Yes, sir.
Mr. President, magandang gabi po. Kanina pong umaga ay nagkaroon kami ng pagpupulong sa pangunguna po ni Secretary Duque, Secretary Lorenzana at iba pang mga key members ng IATF. Kausap po namin yung mga opisyales ng ULAP, kasama po yung League of Provinces, League of Cities, League of Municipalities at Liga ng mga barangay at lahat po ng mga governors at mayors na under po ng GCQ. At maganda po ang naging resulta naman ng pag-uusap. Nagkaroon po kami ng mga kasunduan po kung paano yung pagpapatupad ng mga localized lockdown. Gagawa rin po sila ng kanilang proposal kung paano po ang magandang paraan para ma-handle po yung mga LSI na uuwi sa kanilang probinsya at yung pagpapatupad po ng health standards po. Gusto namin magkaroon po ng isang implementation lang po ng pare-pare sa bawat LGU kung ilang araw po dapat ikukulong yung mga nagbabiolate sa pagsusuot ng mask, face mask at hindi nagpi-physical distancing at kung magkano po yung multa para po kahit saan pumunta ay pare-parehas yung pagpapatupad. Ito po kasi ang pinaka-importante para ma-prevent yung pag-spread ng virus. Magsimula po sa pagsunod sa panuntunan ng bawat mamamayan. Yung pong mga pagkakaroon ng transmission sa iba't ibang community, yun po bunga kapag ang ating mga kababayan na hindi sumusunod sa mga patakaran ng health standards. At tuloy-tuloy po yung aming pag-uusap Gagawin po namin ay pupunta naman po kami sa ibaba at yung mga particular po mga city at down po hanggang barangay na dapat ila-lockdown ay meron po kaming yung tinatawag na code teams. Ito po yung coordinated operation to defeat epidemic. Yung mga expert po ay pupunta doon sa ibaba at tutulungan mo talaga yung ating mga mayor sa pagpapatupad ng lockdown. Kompleto po yung actions na gagawin mula po simula hanggang matapos. At importante po talaga yung mailipat po yung mga positive na patient sa ating isolation facilities para hindi po makahawa sa community. So tuloy-tuloy po ang ginagawa namin ugnayan sa ating mga mayors at governors at sila naman po talaga ay porsigido po na maipatupad yung mandato nila para matapos at malabanan itong COVID, Mr. President.
Mind you, there is a raging fight between federal government and itong local states sa Amerika. Simply because there are mayors who refuse to abide by these rules of when everybody is talking about all experts practically, be it in Europe or America, and the doctors, the eminent doctors, they only have one unison statement. You want COVID slowed down or stop, wear a mask or do not go out of your house if you do not want to wear one. Yun lang, at saka yung social distancing. There is no other way that we can prevent COVID from transferring from one person to the other unless we obey. The only thing that's going our way in our favor is that we are a unitary type of government. At saka ang hold ng central government is different from the United States. They have more freedom there. And there are things which is in non-known and nobody can. But dito sa Pilipinas, pag sinabi ng, well, whatever department is pag sinabi niya na ganon talaga, and you can enforce it. Otherwise, they would be guilty of, well, simple gross negligence or outright if the Secretary of Local Government would deem it necessary for your wanton then you can be suspended. And as a matter of fact, you can be terminated. Yan lang anak pabuti sa iba kasi ayaw. That has no place in the Philippines because everybody is bound by the national policy. Itong atin naman, ang task force is really for the good of the people, for all. Kaya we do not have any qualms in arresting people. It might, under ordinary times, that's what I'm saying, about to say kanina, is that a simple violation of not wearing a mask seems to be trivial, and social distancing, all of these things. But during times of health issues, pandemic, you can, because it can be a serious crime. Transmitting the theory is that you are the carrier. That is why you should wear a mask so as not to pass on the infection to the other guy. Baliktad ang psychology dyan para talagang nawala sila. So, we'll have to ask our police to be more strict. Sa hulihin talaga. A little shame would put them on notice forever. At sino ba naman gusto mo mahuli ka? But if you are brought to the police station and detained there, that would give you a lesson for all time. So, gano'n na. At saka makikita nila. Yung mahirap ito muna sa squatters, gano'n din sa Davao, sabi nila. Sabi nila, hindi ako napunta doon. You ask the police to function the way they should in times like this. Is there any other
Mr. President, magandang gabi po sa inyo, Mr. Senator and fellow members of the IATF. Kanina po nagpulong kami ng gaya po ng nabanggit ni Secretary Ed Año, ang mga kinatawan po ng Union of Local Authorities of the Philippines at ang League of Provinces of the Philippines at ang mga League of Municipalities at iba pa pong mga associations or leagues, no, na binubuo po ito ng mga iba't ibang mga local chief executives, governors, and mayors. At kanina po ginamit namin ng pagkakataon na ibahagi sa kanila ang mga karanasan na magagandang mga karanasan ng atin pong mga ibang local chief executives, yung pong kanilang best practices. Ang isa pong halimbawa dito yung sa Baguio City. Sa kanya pong containment strategy, si Mayor Benji Magalong ay kanya pong shinare o ibinahagi yung success elements of his containment strategy, lalo na po sa patungkol sa contact tracing, Mr. President. So, yung contact tracing ng Baguio po ay talagang masinsinan at talagang kanila pong nasasakupan ang mga na-expose sa bawat positive case ng COVID. At sa totoo nga lang po, Mr. President, ang kanilang ratio is 1:37. For every one positive case, mga 37 ang kanila pong nate-trace na na-expose po doon sa positive confirmed case. At maganda po ang naging resulta nito dahil abot nila yung mga tao, yung first generation contacts hanggang sa second generation contacts. At ito po mga ito ay na-test nila, Mr. President. At sa larangan naman ng testing, si Secretary Vince Dizon naman po bilang ating tinagurian testing czar ay nanigurado po na ang testing capacity ay patuloy ang pagtaas at ang daily testing output po ay mapapataas din po dahil nga kung mas marami pong matitrace, kinakailangan matest po sila kaagad. At ang sabi po ni Sec Dizon ay maabot po natin ang 10 million test by 2021. As of today, ang total tested individuals natin umabot na po ng mga 1,120,000, Mr. President. Sa ganun din po pagpupulong kanina ay ibinigay din po ang mga developments patungkol po sa expansion ng mga isolation and quarantine facilities ng atin pong Oplan Kalinga at si Secretary Mark Villar naman po ang nangunguna sa pagpapausbong at pagpapalawig po ng lahat ng atin mga isolation, isolation and quarantine facilities. Kasama na din po ang mga evacuation centers na posibleng convertible into isolation or quarantine facilities, Mr. President. At kasama din doon po amin na ipinaulat kay Yusek Bong Vega ang bago pong luklok na atin Undersecretary of Health na tutukan po at buuin yung ating pong One Hospital Command system para ang referral system po ay maging maayos mula sa level 1, level 2, and level 3 hospitals and related facilities. So, maganda naman po ang naging resulta ng aming pong pagpupulong, although there will be additional meetings so that we will be able to solidify the agreements and the recommendations po na we arrived at in this morning's meeting. So, yun po ang report, yung apat sa contact tracing czar ni Benji Magalong, ang testing czar po natin na si Secretary Vince Dizon, at ang ating Oplan Kalinga isolation quarantine czar na si Secretary Mark Villar, and last but not the least, si Yusek Bong Vega of the DOH, who will take charge of increasing bed capacities for critical and severe cases. Kasi alam niyo po, Mr. President, ang isa po sa ating pinupuntirya rito ay hanggat sa maaari wala sanang mamamatay, Mr. President. So yung early detection, napaka-mahalaga po rito, at ang clinical management, kinakailangan po clinical best practice management of all COVID cases across all the clinical spectrum of the COVID cases. So ito po, naging mabunga po ang aming pong meeting kanina, Ginoong Pangulo, at ifa-follow up po ito through a recommendation that will finally be approved by the IATF on Monday next week po. So, yun lang po ang karagdagan ulat patungkol po sa ating pong mga meetings. At in fact, nag-meeting din po kami last Saturday, Mr. President, ng mga bilang na mga punong lungsod ng NCR na kung saan po medyo hirap po sila sa kanilang containment strategy, at pinakiusapan po namin sila na sabihin sa amin kung ano po yung mga kanilang tulong na kinakailangan para maayudahan po ng national government. At doon nga po ay nakapagbigay po tayo ng suporta, not only in terms of technical support but also in terms of direct assistance, testing, quarantine facilities. In fact, ang DepEd nga ay kanila pong sinulatan through the IATF na humihingi ng pahintulot na i-extend po yung gamit ng mga eskwelahan as quarantine facilities. At nagpapasalamat naman po kami kay Secretary Liling Briones na nagbigay po ng kanyang pahintulot na para po natin mapagamit sa kanila ang mga naturang classrooms. Yun lang po, Mr. President. Salamat.
May I just add, viewing the events of COVID, yung dimensions ng COVID, in other countries they have this efficient yung ano nila, yung follow-up na contact tracing. Yung iba naman dito sa atin mahirap, I think, but it can be done. But I said it's a Herculean task to do it. Second is yung testing ho. Do we have the capacity to do the testing for every citizen in this country?
Sir, yung testing capacity po natin sa ngayon asa 74,000, but the daily testing output is anywhere from about 20 to 23,000 daily. na-reach na po yung 25,000. Ang target po natin is 10 million Filipinos to be tested by 2021. And we hope to be able to do the test at 32,000 to about 40,000 a day, Mr. President. So, hindi naman po natin pwedeng i-test ang bawat mamamayan. Wala pong bansa ang nakakagawa nito, kahit na po ang pinakamayaman, katulad ng United States of America. Hanggang ngayon, sila na nga po may pinakamataas na kaso, sila din po may pinakamataas na nangangamatay ng kanilang mamamayan, pero ang kanilang testing asa 40 million na, Mr. President. And that's almost close to 9% of the total population of the US, of about 370 million Americans. So tayo po, malalagpasan po natin yon. Magiging mga 10% po tayo. Of the total population of the Philippines at 109 million, we might be able to reach about 10 million Filipinos by 2021.
I say this again because yung testing is also a problem for the US. They have to, in highways, they have to put up some special lanes for you to slow down and do some. If you have not been tested, you will be tested. It's a bit compulsory in the sense that you cannot go anywhere except follow the straight line. And when your time is up, you are there in front of the medical persons. They would swab you and testing. Dito sa atin, well, I think 10,000 would be a good number if you can achieve that. Ang atin lang is, I said, reduce. The thing is, if we can do it, actually, we have to reduce it to the barest minimum na yung tao na hindi yung ayaw in America, because they do not, a good number of people that do not want to be tested because they do not believe in it. So that's a problem. Same with Brazil. It's only now that people are dying and they are short of coffins that they realize that they have to follow the WHO. Wala kasi maniwala noon itong sa mask pati yung social distancing. As a matter of fact, it was the most elementary sa lahat ng right at the beginning, the pandemonium, right at the beginning, it was really a prescribed mandatory thing to have a mask. So, kung natin Pilipino to wear mask, and we can, I said, reduce the number of patients. Any other comment? Secretary Galvez.
So, susundan ko lang po, sir, ang mga sinabi po ni Secretary Duque pertaining yung pagtalaga po natin ng apat na CHAR. Kasi po, yung ating haligi ng ating National Action Plan ay binubuo po ng test, trace, isolate, at saka po yung treat. Dahil po sa lumalaki na bilang ng ating COVID cases, kailangan po talaga matutukan po yung apat na haligi po nito dahil kasi ito po ay talagang sa lahat po ng mga ibang bansa na nakita nating nagiging maganda ang kanilang kalagayan, ay yung apat po nito ang talagang haligi ng kanilang mga estratehiya. Unang-una po kasi yung sa trace. Ngayon po lang namin nalaman na yung ginagawa pala ng ating mga mayors ay kulang pa dahil kasi karamihan po nung inassess po ni Jer Magalong yung lahat ng mga NCR mayors, binigay po nila yung mga report, nagpunta rin po siya sa Cebu, nagpunta po rin po siya sa Region 4A, at ngayon po, bukas po, pupunta po siya sa Region 3. Nakita po natin kulang pa yung ginagawa nating testing. Dahil po karamihan, pagka po nag-trace tayo, ay mababa po yung natitrace natin. Minsan karamihan po sa mga ang ratio po ng mga nakukuha ng mayor is 1:20 ang pinakamataas at iba pa is 1:3. Ibig sabihin, mayroon pong nakakawala na mga positive na gumagala po sa atin. Maganda po yung yung ginagawa po ni General Magalong kasi si General Magalong po na-reduce niya po yung kanyang cases from as high as 49 to 0. So talagang naisiro niya po yung yung mga cases niya and for almost 2 weeks wala po siyang new cases. At titingnan po natin yung kanyang kakayahan. Ito rin po ang pinaka-basic ginawa ng Japan. Ang ginawa po ng Japan is how to follow the trail of the TB, mga infectious diseases. So ang ginawa po ng Japan, pinalakas po nila yung tinatawag nilang more than hundreds of BHERTs, yung mga community facilities. Yung BHERTs po natin, ito yung tinatawag Barangay Health Emergency Response Teams. Ito po yung talagang kung tutusin natin, yung sa Cebu experience po natin, yun po ang pinalakas po ni General Simato. Nung kinausap niya po yung 80 na barangays ng Cebu, gumanda po ang kalagayan po ngayon ng Cebu. Tumaas po ang kanyang doubling time, at the same time, yung kanyang R0 bumaba po ng 1.1. Ibig sabihin yung reproduction niya po, yung transmission bumaba. Ngayon po nakikita po natin, maganda po ang ginagawa ni General Magalong because of his passion. Nag-meeting siya sa lahat ng mga mayors at kinukumpara niya yung mga experience ng ibang bansa at saka experience ng Baguio kung paano po mapaayos ang tracing. At ganoon din po yung sa India, yung sinasabi nga po, in-introduce po sa amin ni SOH, ni Secretary Duque, yung Darabi model, wherein yung hospital po ang pumupunta doon sa mga slum areas. Sila po ang nag-iisa-isa, nag-house to house, kung sino po yung mga may kaso ng COVID. Doon lang po natin makukuha po ang talagang makuha po natin na ma-isolate po natin siya. At yun po, nakikita po natin, ginagawa po ngayon ng ating mga char na si Secretary Vince ay talagang pinaakyat niya po ang kapasidad natin sa testing. Pati po yung supply chain po natin, yung mga consumables, inayos niya rin po. So ngayon po, pwede na tayo makapag-test ng na-break na po natin ang 26,900 na test natin noong July 17. So ibig sabihin, nakapag-test na po tayo isang araw na more or less 27,000 a day. Pagka na-reach po natin yung 32, sinasabi po natin mga dalubhasa na we can save more than 4,000 to 6,000 deaths. Meaning, maiiwasan po natin yung tinatawag nating magkaroon ng dead on arrival. At the same time, bababa po yung mga severe cases kasi nagkakaroon na po na tayo ng early detection. Kasi po, pagka na-detect po natin kaagad ng maaga, symptomatic at moderate, pwede na po nating gamutin. Yun din po ang kagandahan po ngayon na magkakasama po kaming kasama po ni SOH. Nagpupunta po kami sa lahat ng mga ospital. Tinitingnan po namin ang capacity. Mr. President, makikita natin kung maitaas lang natin ang ICU natin na more than 1,000 na ICU beds at saka po yung isolation beds dito sa Metro Manila. Medyo makakagana po kasi kinausap natin po ang mga ospital. Kung sa ward beds, kaya po nating expand kasi ang ng ospital, 30% lang po ang kanilang COVID patients. Pwede pa nating i-extend. Pero yung ICU po, ang hindi po natin ma-extend kasi limited po ang ICU. At karamihan po ng mga critical at saka mga tinatawag natin pong critical at saka mga severe, yung po ang nando sa ICU. So if we will try to dance with the virus, ang isang strategiya po natin, dapat palakasin po natin ang ICU natin. At yun po, nakita po namin sa Quirino Memorial Hospital, meron po tayong mega ER. Yung isang floor po doon ginagawa ngayon, yung isang floor parang isang ER na po 'yon. At meron siyang 50 ICU beds. At doon po sa East Avenue Medical Center, binisita rin po namin ni Dr. Vega at nakita po namin doon meron po tayong 250 beds at saka meron po tayong 25 ICU beds. Kung yun po, may dedicate po natin na COVID, sa COVID lang po yun, maganda po na magkaroon po tayo na tinatawag sa Metro Manila na 4 COVID hospitals dedicated. Kasi po, ang problema po natin, pagka kumakain po tayo ng percentage doon sa mga patient po na non-COVID, yung non-COVID po ang nakokompromise. Yung mga tinatawag nating may dialysis, yung mga cancer, Yun po ang mga nagiging casualty po. So, ang nakikita po namin, we will be recommending na kung magkaroon po na tayo ng zoning sa NCR, meron po dapat tayo ng 4 na COVID hospitals. Para yun, dedicated na hospitals na ginawa po ng China, nagkaroon siya ng in 10 days, they build a COVID-dedicated hospital. Yun po ang nakita namin na mas maganda po kasi nakita natin si Dr. Vega, ang ginawa po ni Dr. Vega, ay nagkaroon siya ng tinatawag na one referral system sa buong NCR at saka sa Cebu. Yung experience po natin sa Cebu, nakita po natin, gumanda po dahil kasi nung pinag-aralan po ni Dr. Vega na yung treatment and care natin, mababawasan po ang pagkamamatay dahil kasi early treatment at saka po yung early detection. So yung pag-design po natin na meron po tayong 4 na char, maganda po yun kasi yung kay Secretary Villar po, more than 167 na evacuation building ang napagawa niya at ngayon po nagagamit na po natin yung 68 doon sa COVID patients na more than 2,500 na po ang kanyang gumagamit po doon. Kaya po lahat po ng tao na mga dedicated na i-assign po natin, si General Magalong, he has the passion to really search for the track yung lahat po ng mga cases. At the same time, si Vince Dizon naman, he is very passionate in ramping up the testing capacity that we had. And also with the supervision of Secretary Villar, yung DPWH po, nationwide po, gumagawa po ng mga quarantine facilities so that we can ready the capacity. Kung just in case magkaroon ng surge, kayang-kaya po natin. And at the same time, si Dr. Vega, through the direction of the DOH, kayang-kaya po natin, kahit na mag-open tayo ng economy, we will be ready to cope and dance with the virus by having an additional capacity, especially kung makapag-produce po tayo ng COVID-dedicated hospital para hindi po tayo magkaroon din ng casualty sa non-COVID. Yun po ang maganda pong gawin po natin, sir. Yun lang po, mahal na President, yun po ang aming report po sa inyo.
My countrymen, we continue to meet regularly to talk about our problem. Perhaps our number one problem today is the COVID. I am as mad as you. Galit ako, pareho tayo sa nangyari. And ginusto ninyo na buksan ko na ang puwerta. Gusto ko yan. Gusto ko ang nagpipigil na lang sa akin, ang science. Gusto ko kasi nagalit na pati ako nakulong na ilang buwan. Naging inutil na rin ako. I have become, except for the voluminous papers, na inutil na ako, wala na akong magawa na, ewan ko. But, you know, COVID is COVID. Alam ninyo, sa Amerika, sa ibang lugar, for those countries, pati China nga too early, maaga sila binuksan. Sinabi sila ng WHO, wag. Binuksan nila, ngayon nagbalik sila, parang second wave. America is still number one, with so many thousands dying. Hindi ito biro, hindi naman ito sabihin mo imbento, makikita mo naman sa TV at binabalita naman dito sa atin. So we are trying our best. We have the Secretary of spokesman to keep you informed of what we're doing. General Defense Lorenzana, Dr. Doke, who has my trust. Si General Galvez, General Anyo, ma'am. Sa education, kay isang sektor yan, na-worried kami. Alam mo, ang edukasyon, kinabukasan ng mga bata yan. They have to finish a course na para mabuhay sila. So, I know the apprehensions of Secretary Bruce. Pero maghintay kayo, maghintay na lang. Actually, ang pinangako ko sa inyo, kung meron ng yung vaccine, meron na final sa trial, sa Russia, binitawan na nila. I'm sure China has already won. Ang Amerika, ang takot ko lang noon, kasi nga mahirap tayo, and we need so many millions also. As a matter of fact, I would need about 110 million para mapainom ko sa lahat, para ang COVID nandyan pa, pero maging inutil na. Pag nakainom na tayo ng vaccine, yung influenza, yung H1N1, nandyan yan sila. Pero pag nakainom ka na ng vaccine, purnada na yan sila. But they remain on the air, but we are immunized already. So, maghintay lang kayo ng konti. Para sa mga plano natin, put it something like hanggang towards the end of the year. But if there is a thing that develops which is really good for you, mauna ako. Mag-utang ako. Magpabili ako kung saan magpabili ng lupa para ibili ko ng medicine. In the meantime, wala. America, Europe, wala isa. O isa lang ang nila, o dalawa, tatlo. Social distancing. Huwag kayong magsigaw-sigawan, nakadikit-dikit. Mask. America, Russia, lahat, China, mask. Ito, importante talaga. Ngayon, kung wala kayo, I will try to buy as many as I can afford. Kung kaya ko, ibigay namin yan sa inyo libre. But wear it. And, baski nagamitin mo siguro yan, 2 beses, okay mo lang. O sprayhan mo lang ng alcohol pagkatapos. Huwag yung in-spray mo, isuot mo kaagad. Yung pagkatapos ng araw, hang it somewhere, sprayhan mo lang ng Lysol if you can afford it. Yung wala, ibabad mo ng gasolina o diesel. Putang, inang COVID na yan. Hindi uubra yan dyan. Totoo. Wala kayong want to disinfect yun, maghanap mo ng gasolina. Babad mo lang yung kamay mo. Layo mo lang kaya baka wag sa loob ng bahay ninyo. In the meantime, ang importante talaga dito is your perseverance. That's the word. You must persevere during this time. Simplihin ko, patience. Total dadating rin yan. Marunong ang Diyos. Alam niya hindi tayo niya pababayaan. Especially Pilipinas kasi Kristiyanos tayo. So, magsakripisyo lang tayo ng konti. Total, ang ating idol, nagsakripisyo man rin. Pinaghampas-hampas, ipinako pa sa krus. Tayo pasimba-simba man lang. Luhod-luhod ganun dyan. So, dedicate it to the Lord that you also suffer for the country. Maraming salamat po.